Hello everyone, I am Dr. Parag Bhalgat. I am consultant pediatric cardiologist working in Mumbai at Sujit Heart Clinic. You can log on to my website for more details. Today I wish to discuss scope of parent counseling and what the set of questions parent ask me, the set of information parent ask me when I disclose diagnosis of fetal echo or pediatric echo to the parents. Parents are quite anxious and they wish for a lot of information in very simple and easy language that they can understand. Let's see. Pregnancy is a very joyful period for parents and they are eagerly waiting for arrival of new kid. Everybody is expecting a healthy and newborn baby. When a possibility of any defect is discussed with parents, they are taken aback. It's a very catastrophic event and they find it very stressful to deal with. Every individual has got a different socioeconomic background. His upbringing is different. His religious and cultural beliefs are different. He thinks differently for given set of situations. So for same problem, parents think differently. No two parents think same for same heart problem. So when I disclose a diagnosis, they want a very clear diagnosis. They want what is the baby has got. Many times I have to draw diagrams, show them pictorially, and I tell them very frankly in details, like whether it is a ventricular septal defect or it is a very large perimembranous, multiple mid-muscular, or a very large defect amounting to single ventricle. Because all these three conditions has got different prognosis, different management plan, and life of baby is different in either of the cases. They want to know what is the management plan for this defect, this particular peculiar unique defect their baby has got. And they wish to know in a very simple language. They want to know what baby will have before delivery and after delivery. Number of surgeries baby will have. Sometimes surgery is required immediately after birth within a week's time, or sometimes it is required little later in life, maybe at 4 to 6 months or even little late. Sometimes only one surgery suffice, or okay, in some complicated defects, 2 or 3 stage repair is required. When all these stages have to be carried out, are they in isolation or they require associated cardiac interventions? What are the complications of surgery? What is the morbidity, mortality due to all these surgeries? Once baby has gone through all these surgeries, how will his life will be? How will he behave, say 15 years, 20 years down the line, maybe 40, 50 years down the line? What are the long-term complications that we will come across when baby grows old in second or third decade, fourth decade of life? Because some set of diseases come with long-term follow-up, long-term complications. And parents need information regarding that. Heart defects carry a significant toll on physical activity, especially if it is associated with complicated anatomy, single ventricle anatomy. And these babies are not able to participate in competitive sports. Mental growth and intelligence may be subnormal with complicated heart defect like hypoplastic left heart syndrome. And otherwise it is generally normal. Parents want to know how the scholastic performance and general performance of the baby would be in the school, colleges, or at his profession, which is going to happen 20 years, 25 years down the line. If baby turn out to be a female kid, will she able to conceive? Because pregnancy is a difficult undertaking and carries a lot of burden to heart. Complicated heart defects, even after surgery, may not have a babies. Is it in isolation or it associated with some other syndromes, some inherited problems? And diseases like Downs or Sturge-Weber syndrome have some genetic association. And genetic counseling is a now big thing that we have to discuss. This also includes risk in next pregnancy, how to go ahead with genetic evaluation, different tests required, how to interpret tests. Parents also want to know how it is going to affect their life as a parents. Big question they ask, why we and why our child? Where that fault? So they had got a defective child. What are the financial implications? Number of surgeries and the cost of each surgery. Then how long the medical follow-up will go up? What are the investigation required in between? What is the cost of the same? Parents for every surgery has to undergo a lot of mental and physical stress. So they discuss all these problems with, and some diseases, as I already mentioned, require a follow-up in second or third decade, even fourth decade of life. In a nutshell, uh, any heart defect in a baby can affect an entire family, not only the baby and the parents, but entire family. As a pediatric cardiologist, I am trained in heart defects. We understand what is the natural history of disease, what will happen after surgery, what are the long-term complications. So we can answer most of the questions that parents have got. We can answer long-term issues, long-term effects of surgery, life expectancy, physical and mental growth. Most of the questions that they have asked can be answered by a pediatric cardiologist. With this discussion, we also discuss what are the options they have got, where they should deliver the baby, which facility, the medical facility required for a cardiac defects is different from general NICU. What is the postnatal care that will be required? It is discussed with parents, treating obstetrician, interventions required. If parents do not want to continue pregnancy, then what are the options available? Can they go for termination of pregnancy? This is discussion goes in hand with the treating obstetrician. Is there role for in utero interventions? These are very, what to say, budding field, very little scope is available right now. Most important thing about all this parent counseling is informed decision making. Parents need time to accept the fact. We should respect their free will. We should respect their social, cultural, and religious beliefs, personal upbringing, and never offer any possible miracle cure or miracle therapies that may happen 20 years, 30 years down the line that can cure these heart defects. Because our discussion is valid to the evidence available right now. Some parents even ask me, my baby has got a heart defect, so after delivery, can you go for heart transplant? But one has to clearly tell them that heart transplant is a palliative procedure with a definite median survival rate. So all this process and counseling require a lot of time, patience, and empathy. Thank you for your valuable time.